Dear colleagues, this is a routine unedited phaco surgery. Let us watch the surgical steps. This is the main incision. It's a posterior limbal incision. You can see oozing of blood from the main incision. Now this is a side port on the left side of the main incision, about 3 clock hours away. And in this case I have made only one side port. Now my plan is to stain the anterior capsule with Triban Blue 0.06% dye. Underneath this air bubble, here goes the dye. The dye should be sprayed evenly over the anterior capsule. Now the dye is washed out because there can be some particles which can get lost under the iris, and it can cause inflammation, postoperative unwanted inflammation. Now viscoelastic substance is injected into the antechamber. We can see there is the uniform staining is not there. Somewhere it is stained deeply, somewhere it is stained lightly. However, we can manage in this case. Capsular tag has been raised by 26 gauge pen needle. Take a ureter now and hold this tag, go anti-clockwise and do this rhexis. It is a continuous curvilinear capsular rhexis. A little larger it has become. Ideally it should be a little smaller in size. And now hydrodissection is done. The nucleus is tapped, the nucleus is rotated, and you are ready for introducing the tip of the phaco handpiece. Visco is injected. The machine being used is Oatley Cataract 3. This machine has very good hold over the nucleus, and you can chop the nucleus very easily. Superficial cortical fibers are removed, and now the tip of the phaco handpiece is buried into the substance of the nucleus, go through the nucleus towards the opposite equator and chop it. This is what I call submarine chop. Hold it at another place and chop it. Now this free nuclear fragment is being emulsified and removed. Rotate the nucleus, hold it here, chop it and remove this fragment. So as I chop it, immediately I am removing the fragment by emulsification. Phaco power being used in this case is 70%, flow rate is 45 ml per minute, and vacuum is 450 mm of mercury. The last nuclear fragment has been emulsified. This is the epinucleus. Just pull the epinucleus at the center, and when it comes at the center of the antechamber, then you apply a little bit of phaco energy, say about 10% phaco energy, and emulsify this epinucleus and remove it. That's it. And now in this case we can see there is lot of cortex. We have only one side port, so my plan is to use a 23 gauge Simcoe cannula. Through the main incision, most of the cortical matter is removed, and it is very fast. So most of the cortical matter has been removed in few seconds. Now I go through the side port and remove the sub-main incisional cortical matter. That's it. After removal of the cortex, what is done is little bit of polishing of the posterior capsule is done, and then this is hydro polish. Jet of fluid from the irrigating probe is used to polish the posterior capsule. And now in this case I am implanting a hydrophobic single piece intraocular lens under irrigation, keeping the antechamber formed by irrigation. And the irrigating probe supports the drilling haptic, supports the optic of the lens, and places the lens in the capsular bag. That's it. The lens is in the capsular bag and the case is done. You just have to inject a little bit of moxie, hydrate the side port and conclude the case. Thank you very much for watching. Hope these videos which I am posting almost every day are becoming helpful to you. Main thing is to inspire you. Main thing is to hammer on your head to become a better surgeon. Please do very good surgeries for all the eyes, whether the patient is able to pay or not. Don't think about the paying capability of the patient. Do your best. Thank you very much.